Welcome to the New Mexico Department of Health Influenza Immunization Training. This training is a requirement for all clinical volunteers and was developed in partnership with the New Mexico Department of Health, the New Mexico Immunization Coalition, several nurses, physicians, and pharmacists. We hope you enjoy this training and that you receive the review and guidance that you need to hold a safe and successful influenza vaccination clinic. We appreciate you taking the time to watch. This training is intended as a review for anyone who will be administering vaccine during a mass flu clinic this season. Nurses, pharmacists, EMTs, physicians, community volunteers, and any health sciences students who will be administering vaccine. Each year, influenza vaccine formulations can change, and it's important to be aware of the current year formulation. The guidance for storage and handling can also change. Please know that this review is necessary for all participants, whether you have participated in many flu clinics or if this is your first time. This training will provide an overview of the flu vaccine, how to screen patients for contraindications to influenza vaccine, proper storage and handling, vaccine administration, side effects, and emergency procedures, and some tips for holding a successful flu clinic. The first part of this training will provide a quick overview of the flu vaccination during the COVID-19 pandemic. This year, flu vaccine will be more important than ever. Each year, thousands of people die from the flu, many hundreds of thousands are hospitalized, and millions are sickened. This year, because we are in the middle of a pandemic, we want to minimize people getting sick with both flu and COVID-19, which we know can be more deadly than either virus on its own. We want to avoid unnecessary trips to the hospital, or to the doctor, or to the emergency room, and we want to keep our hospital beds available for patients who are sick with COVID-19. Our challenge this year will be to safely immunize as many people as possible against flu, to do it early in the season, and to do it while maintaining proper safety precautions, such as wearing masks and maintaining social distancing. Many providers will be holding special flu clinics, such as drive-through clinics, or clinics that will be vaccinating patients in the parking lot without needing them to come into the waiting room. For regular appointments, we are encouraging providers to offer flu vaccine at every visit, no matter what the appointment. And pharmacies will play an even bigger role this year in getting our population vaccinated against flu. All healthcare providers participating in any flu vaccination clinic must have completed and reviewed the OSHA bloodborne pathogens training and the HIPAA training. These are required for participating in any community health event. If you have not had these trainings, you can take them online at no charge through New Mexico Train. We will also provide a link at the end of this training to those websites. The next section of this training will cover screening. Screening for flu vaccine this year will involve more than filling out and reviewing the consent form. Clinical staff and volunteers must adhere to the New Mexico Department of Health influenza protocol, but must also follow the proper PPE or personal protection. The New Mexico Department of Health influenza immunization protocol will be available to all clinical volunteers and staff who are participating in any DOH flu vaccination clinic. This protocol serves as your medical orders and must be adhered to. Please be sure to review this protocol before the day of the clinic and again on the day of the clinic. Some of the key areas to review in the protocol include this year's personal protective equipment requirements, vaccine formulations, how to administer the vaccine, the current schedule and dosage, contraindications, storage and handling, adverse reactions, and how to determine whether a child under 9 years of age needs 1 or 2 doses. Because of COVID-19, we must ensure that patients are physically distanced at least 6 feet apart and that all patients over the age of 2 must wear masks. Cloth masks are fine. In addition, vaccinators must wear a mask, a face shield, and possibly gloves. Be sure to check for the latest Department of Health recommendation and your organization's guidelines. If gloves are required or used by preference, they should be changed between every patient, and the vaccinator must wash their hands or use hand sanitizer before putting on new gloves. Surfaces that are touched by the patient, pens, clipboards, surfaces, iPads, must be cleaned and disinfected between patients. Next, we will go over the forms. A key component of a mass flu vaccination clinic is getting information quickly and efficiently from patients. Using an online registration form will speed up the process considerably and reduce the need to clean items between patients. There will still need to be a COVID screening questions right before vaccinating at the clinic, but most of the patient information can be filled in ahead of time by the person registering. This also saves time and person hours entering information into the electronic medical record or NMSIS. As ReadyUp can upload directly into NMSIS, this will be a valuable tool. In some cases, paper forms are Another advantage of the online registration form is that the person registering must include all the necessary information or the registration will not go through. Once a person registers and arrives at the clinic, their identity must be confirmed to match their online registration information and to make sure all the family members are included in the online registration. It's possible to have last-minute additional family members tag along, but they will need to have a consent form completed before they can be vaccinated. Before vaccinating, patients arriving at the flu vaccination clinic will need to be screened for any COVID-19 symptoms, for fever, and for possible contact with someone infected with COVID-19. This is in addition to the regular flu vaccine screening questions about anaphylactic allergy to eggs, to any component of the vaccine, or prior severe allergic reaction to a dose of the flu vaccine. If a patient is requesting FluMist, the inhalable vaccine, and you have it available, you must also screen for whether they have received any other live virus vaccines in the past 4 weeks. Common live virus vaccines are measles, mumps, rubella, varicella or chickenpox, FluMist, and yellow fever. Patients who are receiving inactivated influenza vaccine or the shot can receive their flu shot regardless of whether they have received any live virus vaccines in the recent past. We especially recommend that pregnant women be vaccinated against influenza, and it can be during any trimester. But please note that FluMist is contraindicated during pregnancy. Some children under the age of 9 will need 2 doses of influenza vaccine this flu season to be protected. If a child has received 2 or more doses of regular seasonal flu vaccines prior to July 1st, 2020, or if they are 9 years old or older, then the child will only need 1 dose. If it's unknown whether the child under 9 has received 2 doses of vaccine in their lifetime, the child should receive 2 doses with at least 28 days in between. Here's a schematic for the algorithm. Each year, the Centers for Disease Control and Prevention issues a vaccine information state for influenza. The online registration form will include a link to the most current version of the injectable influenza VIS and the FluMist VIS. The current VIS issue date is August 15th, 2019. If a patient has not registered ahead of time, we must have available on hand a copy of the VIS for them to review.